Ready? Okay, what's step one?
Body substance isolation, pen man.
Okay, BSI pin man. The second step is going to be to locate the injured extremity. Come up on scene, ask Mr. Egger there, where's your injury at, sir?
Hello, sir. My name is Braden. I'm an EMT student at Crafton Hills College. What seems to be the problem?
I broke my right leg.
You broke your right leg. Can you tell me which is it the top area or the lower area?
The lower area.
The lower area? Okay.
Okay, so now we would cut and expose, right? If we're out in the field, patient, cut and expose, we got to see what we're working with. Okay, we'll
Cut.
pretend. Okay,
Cut.
so now you want to direct your partner to hold spinal mobilization, to stabilize the leg over here, the right extremity. So you want to go on that side over there next to your patient. Kind of like we did the arm last week, right? We're going to go above and under, and you want to stabilize this leg. Okay, good. Right. Next thing we want to do is check PMSEs bilaterally. So by that, we have to take off shoes and socks, right?
Oh, yeah.
We can't check pulses through the boots. So we have to take off the shoes and socks. Remember, once again, make sure you're nice and gentle with the patient. We don't want to cause any kind of gross movement. So I also need to take off the socks too, so I can
Check
take
it.
off
Take
the
off the socks too? Okay.
And do you have a Sharpie present on you?
Me? I
Yes.
do not.
Does anybody have a Sharpie pen? Anything?
I have a ballpoint pen.
Well, that should work. Okay, so once we find our pulse, we're going to mark it with the X, right? So find your pulse. It's best to do it one at a time. That way you can mark it once you find it. And you guys will see that pulses can be difficult. That's why we have to practice in here. That way you're not in the field training on your day one and don't know what to do, right? So once you find your pedal pulses,
Okay, I found it right here.
okay, mark it. Same with the other side.
Found it.
Okay, good. Okay, so what do you do after pulse?
Motor.
Motor, okay.
Can you wiggle your toes for me, sir?
Okay, sensory.
What toe am I touching?
My pinky.
And then
My cap refill.
cap refill.
Okay.
Instant.
PMSEs are intact, right? Okay, good. Okay, so after that's all done, we want to measure the splint for the injured extremity. So we have our splints here, right? So would this be the appropriate splint for a leg, or would it be this one for a leg? Leg splint, right? Okay, so measure it. So it's gonna come like this in a box, as is, okay? So you guys see it. Oh, cameras, oh yeah, I messed up. There we go. Cut and paste, there we go.
See how I put the flaps in between each other?
So the flaps go here, it goes here.
First.
Here you go, grab it from me. Grab it, tape it all the way across.
All the way to the other side.
Good,
All the way down. There you go.
good,
To the bottom. And put it on the bottom.
awesome. Okay, good job. So once again, this can't break, right? Because
Yeah.
that's cardboard, okay? So we want to pad that. Remember we talked about filling the voids? So this is great right here. It's a great trauma dressing here. So we're gonna fill the voids. Gives a little bit of padding as well for the patient's comfort too, okay? So now you want to grab that. As you can see, the leg's elevated, perfect, right? So we can slide it underneath there, which is gonna be perfect.
Let's go about right there. Are you able to bend your foot like that? There you go.
Okay, so now what you can do
Now
now
relax your foot.
is
There
you
you
can kind
go.
of hold this nice and tight here a little bit. Now you're going to tape this, right? We talked about it earlier, or acrylics is fine as well. Don't ever want to cover the wound, right? So the fracture is here.
Yeah.
We don't want to cover that, so we want to keep that open.
I don't want to hit his hairs.
So don't forget, always provide, make sure your patient's comfortable, talk to your patient. Good thing to do is you are sitting here, right? Talk to your patient. Have a conversation with them, right? So that way they're not just staring at here, it's quiet. Have a conversation, what's your name, what are you doing, right? That works really well. It also comforts the patient too, so he's not just so focused on his fracture, right? Okay, good. So once that's done, we're gonna fill the voids if needed be. Do you have any voids here as well?
Yes, I do.
Okay, so we can always void those, fill them up. I can use this little dressing here, right? Okay, looks good. A little more padding on there.
That's too thick.
So we can cut that to size, right? We grab our
Okay,
trauma
yeah,
shears
yeah.
out, cut it if we have to. We have smaller sizes, right? So
Is it fully against the back?
Yeah, it is.
Okay.
okay, looks good. So you're holding that still until your partner tapes that there.
Cut those filled voids.
So don't forget, we always want to also mobilize above and below the joint too, right? So we're good, we're above it, we're below it, we're good here as well. Cut that if necessary. How you feel, okay?
Yeah.
Okay.
Fine.
We'll take care of you, okay?
Okay, thank you.
Offer emotional support, all right? Okay, so now we want to reassess our PMSCs, and this is, don't forget too, after that, if we need to put them on a backboard because they did have collar pain up here, neck pain, we'd always put them on a backboard as well too, right? So that's the good point of checking your repeal pulses, right? You marked them, so now you know exactly where to go back and look for them, right? So marked them, now I know exactly where they're at.
Feel pulse, motor. Can you wiggle your toes for me? Sensory, what toe am I touching?
My big one?
Cap refill.
Cap refill is immediate, right?
Yeah.
Okay, good. And then transport.
Transport.
Okay, good.